Over the last few weeks, the COVID-19 situation has continued to evolve throughout the state and the communities we serve. I want to take a moment to talk to you about how we are providing testing here and the steps we are taking to ensure that we are ready to care for COVID-19 patients if we experience a surge at Phelps Health. We have been asked how patients get tested for COVID-19 at Phelps Health. Patients who have symptoms of a respiratory illness first will be tested for influenza or strep. If these tests come back negative, but the patient meets the criteria for COVID-19 testing according to the state and CDC guidelines, we have two testing options. First, a provider can call the Missouri Department of Health and Senior Services lab to order a swab for testing. The provider will describe the patient's symptoms to the state and request permission to test the patient for COVID-19. The state health department will approve or deny the provider's request. If approved, the patient will be swabbed for COVID-19 and the test will be sent to the state lab. Results are usually received back within 24 to 48 hours. The second way involves testing through a commercial lab. If the provider still feels the patient's signs or symptoms may indicate COVID-19, the provider can swab the patient and send the test to an independent or commercial lab. Results sent to an independent lab are usually received back within 3 to 7 days. Over the last 2 weeks, we have begun to make available commercially provided lab testing for COVID-19. This has allowed us to test about twice as many patients per day than we were able to test in the past. This additional availability of testing allows more community members to be tested, ensuring that we know more about the disease process in our community. Another question we are asked is how much a COVID-19 test costs. We know cost is a concern for many individuals and families right now. Back in March, Congress passed the Families First Coronavirus Response Act, which requires all COVID-19 testing and related services to be completely covered by government insurance plans, including Medicare and Medicaid, and most private insurance plans. In addition, visits to doctor's offices, urgent care centers, emergency rooms, as well as telehealth visits must be covered by insurance companies as long as these visits relate to providing or administering a COVID-19 test or determining the need for such a test. What this means in the simplest of terms is that in most cases, there will be no cost to you, the patient, to receive COVID-19 testing. Over the past few weeks, we have been planning for a potential increase or surge of COVID-19 cases at Phelps Health. We are taking steps to expand our capacity and ensure we are equipped to protect our staff and serve patients in our community. In anticipation of a surge, we have been proactively asking individuals and businesses to donate supplies, including personal protective equipment for PPE, such as N95 masks, isolation gowns, and face shields. We currently have the supplies on hand that we need to care for patients, but we want to have more in reserve in case we experience an influx of patients. In addition, we have turned several wings of our medical oncology, acute rehab, and pediatrics floors into negative pressure areas in preparation to care for potential COVID-19 patients. Earlier this month, we temporarily suspended all visitors at all of our locations. This decision was not made lightly, but we felt it was necessary to further protect our patients, staff, and communities from the spread of COVID-19. This means no visitors are allowed at Phelps Health, hospital, or clinics, with limited exceptions. We also implemented wellness screenings for all individuals entering our facilities. These screenings, which also apply to our employees on a daily basis, include checking people for fever and respiratory symptoms. We want you to know that we remain committed to serving our patients and communities. We know the spread of COVID-19 has caused everybody, including all of us at Phelps Health, to adapt to a new normal. We miss seeing our patients, visitors, volunteers, and community members. However, we want you to know that we will remain committed to serving and protecting our patients, staff, and communities for however long this crisis takes. Our employees deserve enormous appreciation for their continued commitment to ensuring those seeking our care receive unmatched compassion and quality of services. We are also extremely grateful for the outpouring of donations for our employees, including food and beverages, personal protective equipment, homemade masks, and more from local individuals, organizations, and businesses. Our community has always been extraordinarily generous and supportive. We are all in this together. Please visit Phelps Health's social media pages and website, phelpshealth.org, for the latest updates on COVID-19.